drug interaction of the skeletal muscle relaxant. So for example, if we are going to we're going to do three for the non-depolarizing blockers and one for the depolarizing blocker. Okay, so if we combine non-depolarizing blocker with the antibiotic, or if we combine with a non-depolarizing blocker with the loop or thiazide diuretic or with the general anesthesia, so it will potentiate its effect. Okay, so it will potentiate its effect. मतलब antibiotic is going to potentiate the effect of non-depolarizing blocker, or loop or thiazide diuretic is going to potentiate the effect of non-depolarizing blocker. But if we are going to combine the depolarizing blocker, which is succinylcholine, with the thiopentone, so they both are incompatible of each other. So if we are going to put it together in one syringe, so what's going to happen, they're going to precipitate in the bottom. So that's why we should not give it together. Okay, that's it. Now there's a thing called factor affecting the action of the neuromuscular blocker. Factor affecting the action of the neuromuscular blocker. For remembering that, you need to remember the mnemonic Hyderabad India map. Hyderabad India map. So Hyderabad is the hypothermia increases the action of the neuromuscular blocker. Inhalational anesthesia increases. Myasthenia gravis reduces, and antibiotic increases, and pH, if the pH is less, so it's going to increase a potential effect. Okay, what are the factor affecting the neuromuscular blockers? They are Hyderabad India map. So hypothermia increases, inhalational anesthesia increases, and myasthenia gravis reduces, and antibiotic increases, and if the pH is less, acidic pH is going to increase, potentiate the effect of neuromuscular blockers. Now we're going to do the uses. So it's going to be used for the obviously we already said that it's going to be used for as a general anesthetic. It's going to be used for the endotracheal intubation, endoscopy, orthopedic manifestations. Let me show you. I have written it. Oh, it's gonna be easy for you guys. Wait a second. Yeah, here we go. So it is going to be used for the as an adjunct to general anesthetic, endoscopies, endotracheal intubation, orthopedic manipulation. Manipulation, is it manipulation? Yes. Then it's going to be used for tetanus, status epilepticus, and ventilatory support in critical patients as well. Now we're going to do the reversal of the neuromuscular blockage. So we are going to give hydrophonium or neostigmine for the reversal of the neuromuscular blocker. Okay, and there's a thing called the dantrolene. I already told you we use it for the treatment of the malignant hyperthermia, and it's going to be blocking the calcium black channels, so the calcium will not be released. So it is going to treat the malignant hyperthermia, and is also going to be used to reduce the spasm in the multiple sclerosis and palsies and spinal injuries and sclerosis, etc. Okay. The last thing is the botulinum toxin. So botulinum toxin is it's going to break the snare protein. So snare protein will be breaked. So there's the acetylcholine will not be released. So when the acetylcholine will not be released, so there won't be any contraction. Okay. So it is used to treat spastic paralysis, spastic muscles. Thank you.